Welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and today we're going to talk about electronic health records. And you may be sitting there thinking, why would I want to sit here and listen to a podcast episode, 30 minutes about electronic health records? It sounds boring, sounds mundane, but this came about from several clinic visits that I've had recently where people have asked me about certain things regarding their records and how to use things like the portal, what's appropriate, what's not. And I said, this would be a good opportunity because I don't think most people realize how much of an impact electronic health records have had or has had on healthcare, how we deliver healthcare now, and even healthcare costs in the past 100 years. So, we're going to, by the end of this episode, go through some of the history of how our current EHR system comes about. And if I say EHR, that's just, shortening electronic health records. So go through some of the history, go through some of the nuances that we've been dealing with, and hopefully you'll have a much better appreciation and understanding of how we arrived to where we are today. The other important thing about this topic is, especially as we move into this new era of AI in healthcare, you need to understand how AI is going to incorporate into electronic health records. What does this mean from a regulatory standpoint? What will it mean from a practical standpoint of just getting things done? So this is these are the reasons why I decided to talk about EHRs or electronic health records and really dive into this so that hopefully you'll have a much better appreciation of what has gone on in this industry and how we got to where we are today. So we're going to look at this era from paper charts, manila folders, to these complex digital systems that we see today, and even talk about how all of this has played a role in physician well-being and clinical burnout, and even patients responding to their response to electronic health records. And some of them haven't liked, I don't like the fact of my doctors constantly plucking away at a computer instead of really paying attention to me. And in preparation, I read several articles, and there was a really interesting framework from Kevin Johnson, a review article that he did several years ago called The Electronic Health Records and Clinical Burnout, Story of Three Errors. So this is a really interesting article, and I'll kind of frame it during the talk as these three errors of electronic health records and where we're going to go and where this thing looks like in the future. When you think about this first era of electronic health records, and let's go back in history, and for most of you who've listened to my podcast, you know that I'm a fan of medical history. I love talking about medical history because I think you learn so much from history and where we are today. But even dating back to 1600 and 3000 to 3000 BC, there were forms of electronic, or not really electronic health records, but forms of health records that were translated from Egyptian hieroglyphic inscriptions. Things like descriptions of certain cancers, descriptions of certain, medical illnesses that have been translated from these inscriptions. So the documentation of the human condition in healthcare dates back to BC times. Even, like I said, the Egyptians, hieroglyphics, before we had modern, even paper or documentation, there has always been this thought that those in the healing practice needed to put this down on paper so others can see, so others can learn from this. Now, this evolved during the era of Hippocrates through the 18th, 19th centuries when doctors realized that these human conditions that they were seeing in this part of the world versus other parts of the world, we need to document this. We need to document it. We need to share so that we can learn what's going on. And that was really this golden age in medicine where you really saw the advancing in medicine, and people started talking about treatments and everything else because we started to really share records. And a lot of times that was in the form of books written about certain conditions or papers that started to be published once we moved into the era of the printing press and mass dissemination of newspapers. That made its way into healthcare. And so you started to see this widespread dissemination of descriptions of patients' conditions and different things like that. And that did allow you as a physician to maybe see something that someone, even if they're halfway across the world, describes a condition in one of their patients, and you say, oh, I have someone that looks like that. So even though we don't have a name for this condition, we don't have a name for this constellation or group of symptoms, well, I know that others are seeing this as well. But for most people, when we think about modern healthcare records, we think of the paper chart and this thick manila folder of chart, often handwritten notes. And, not without dating myself, I kind of went through training and everything else during this transition period from a lot of the paper charts into the electronic health records. So I remember whole rooms of nothing but just charts, like from wall to wall, patient charts. And if you wanted to hear so how we would prep for the next week is that your MA or a nurse or somebody in the office had to go through, figure out who was coming to clinic that next week. Then they had to go to this room and, pull the chart and have it ready for the next week. Well, guess what? If someone misplaced the chart or didn't put it in alphabetical order, or heaven forbid someone has a hyphenated name, trust me, all heck would break out because you couldn't find this patient's chart. Sometimes, after you see a patient, you still had the chart on your desk, and sometimes you take the charts home, and if you misplaced the chart, there was all type of regulatory and problems. You could get fined because that was the documentation. That was the health record. So I'm not here to say that electronic health records are bad. I'm not here to say that because I've seen the alternative. I've seen what we used to do before, and I can say that we have made tremendous strides in this because, if you lost or if a chart was lost for whatever reason, or if paperwork was put into the wrong chart, it was like a black hole, and it essentially lost, and it took everything to really find it. And even in the hospital, outside of a patient's room, you would have this rack, and the chart was there. And the chart was usually, sectioned off. You had the history part. You had the part where the doctors would write their notes. If you could understand the doctor's handwriting, you would have the lab section where you could look at labs and results. You had another section where you looked at the past history. So that was medicine. But the problem with that is that, you could go to a patient's room and the chart's not there. And usually some doctor has it in the back room corner of some room, sitting there going through it, trying to figure out what's going on. So you had a choice. You could either come back and see that patient later, or you had to just sit there until this doctor or whoever was working on the chart would finish, and then you could use it. So that's one of the great things of advancements in healthcare records is that now, multiple people can work on the same chart, at the same time. So overall in that world, information was slow. It was local. If you wanted to see a specialist across town or another place, someone had to physically take out the pieces of paper from the chart that you wanted to send over, and we had to fax it. And that's right, I did say fax. A lot of people today probably don't even know what a fax machine is or what it looks like, but every doctor's office had a fax machine. And we were using faxes, well after fax machines and faxing became when most people had pretty much gotten rid of it or eliminated. It was still in healthcare because that was the safest and most efficient way to send someone's records. So it was a time when things were local. You were really dependent on local, and if you ended up in the emergency room or something else, the team was really dependent on the records that you brought, because it was really hard at that point. Or on the weekend, you end up in the emergency room on the weekend. It's hard to get any records because all the offices are closed. So there were all these nuances with paper charts. But, the great thing was that medical records were not as, voluminous or just a bunch of extra stuff. This bloat, what we call note bloat, that we see today, because back then you just didn't want to, make this chart excessively huge. And even with the filing and the billing practices, you didn't have to put as much stuff in your note. I remember reading some medical history books about like medicine and the Wild Wild West, the U.S. expansion into the West, and this doctor ride in on his horse and see a patient, give him some medication, and the note was like 3 sentences long. It was like, I saw this young lady and she has dysentery and I prescribed this medication. I'll come back and see him in 2 weeks. And that was the whole documentation of the visit. And I've seen some of these records that have been preserved for historical factor, and said, man, that was in the good old days of medicine when documentation. Now you can look at that and say, well, there's so much that's left out, so much you couldn't learn, but that was historically the extent of medical records at the time. So now, as the computer system started to evolve, so did electronic health records. So starting in like the 1960s, you saw big institutions start really focusing on health records. The American government started saying, hey, how do we computerize this? And you mostly saw it in like large hospitals, large clinics, where you had, again, rooms and rooms of huge paper charts that said, look, we got to be able to do this better. There has to be a more efficient way. And especially with these new things called computers, let's figure out how we can use this to consolidate these medical records to make things less clunky, to make it more sophisticated. And so these tools can help out. So I think of this first era in electronic health records as the era from digitizing from filing cabinets. And the goal was so that we can easily track patients, more reliable. You had more people using hospitals and clinics. So we needed to be able to track patients. We needed to be able to get records to other physicians in a safe way that protects the patient's rights, HIPAA rights and all of that, but without depending on like these clunky fax machines. This whole era at the time, the health insurance industry started to really come around as well. So now we're talking about managing billing and insurance issues as well. So how do we use a system to make sure that doctors are accountable for what they do and that they can bill and get paid appropriately for what they do? And with computers and insurance and everything else, this era of big data, more labs. And so how do we store these labs and get them to where they need to be to the people who needed to review them? So there was this kind of hybrid world where most people had part of the records on paper charts, part of the records in the computer. You were switching back and forth, and that created a problem. As you can probably envision, missed information, which to the average physician that just wanted to see patients and go home to their family, you started to see this burden of the electronic health records you start to see burnout start to happen during this first era, where the promise was mainly of administrative efficiency, but in the end, the burden fell on the staff and the physicians to really get things done. So you saw this new workflow and how to capture data and get things done. And those who are, a little older will probably remember this era where you're sitting there waiting for someone to find your chart, find your file, or they say, oh, we can't find your chart because it's a whole chart that's missing. So it did create some problems in healthcare. So this process became very time consuming, and the House of Medicine knew that, and they knew that something, had to change, and electronics health records needed to, or it looked like it may be the change that doctors needed. As computers continued to evolve around, the 1980s, 1990s, healthcare started saying, okay, this might be the answer. This might be the answer to consolidate health records and really be able to put this stuff together. But as with any system, when it first starts, it becomes cumbersome. You don't know how much information to put in, how little information to put in. So the seeds of burnout really started to come into fruition. There was more clicking, more screen time, and there still was not enough help in making these clinical decisions or saving meaningful time when it comes to the use of healthcare or healthcare records. So this brings us to this second era where most of us really started seeing EHR in everyday care. And this could be called like the meaningful use era. This was the era when governments, especially like the United States, began to strongly encourage the adoption of electronic health records through policy changes and even pay incentives, to the point where then later on through the Affordable Care Act and different things where it became mandated, where you had to use electronic health records. And I will say that, it may sound like I'm talking down about the government, what they did, but having worked at the VA early in the system, the VA's electronic health record system, Veterans Administration, was actually one of the first electronic health records used, where veterans can be seen in one state, move and go to another state, and that doctor in that new state could see their records. So it was a model that at the time showed that electronic health records did work, because the key thing was interoperability. So if I move, or if I go to a hospital just across town, how do I get my records without depending on faxes and so forth? So during this era, we saw that electronic health records were starting to be used in a different way. They were used to, they call it enhanced decision support. And, we still see this today in AI as well. I like to think of this era as the multi-click era. It was checkbox medicine, because everything you had to check all these boxes. Even if you want to prescribe a medication, you would have to check all these boxes. Does it any prior allergies? Have they ever been on this before? Have they tried? So there were all these boxes you had to check. But the problem is that, okay, if you want to increase the dosage the next day, you had to check all these boxes again. So it really became, into a physician's side, like a waste of time. And why am I continuously do this? The other thing is, when you start tying these electronic health records to meaningful use, and you start putting that together with reimbursements, you saw certain things like patient data. You saw e-prescribing or electronic prescribing coming along and sharing of this information. So systems were upgraded or purchased at a rush. Clinics knew they needed to get this, or they'd be left behind financially. So there became a huge financial incentive. Now, the problem with this is that we said we were going to mandate health records. Health records are going to be the future. But when they started to develop electronic health records, the first person they went to were the insurance companies. And the House of Medicine didn't really have a whole lot of say in the development and implementation of electronic health records early on. So what you got was a product that was heavily built around checking the boxes to get insurance, to get reimbursed, but it wasn't really about the clinical history and what physicians really cared about. And that was one of the biggest arguments that physicians had about the implementation of electronic health records, was that, we really didn't have as much of a say in the development as we would like, because we could have told the industry that this doesn't make sense, or this is just extra work that we don't need. And so now, fast forward to today, as AI, artificial intelligence, really starts to take hold, we're trying not to go through some of the same things that we went through in electronic health records, and being a part of that process of developing these systems and really pushing them forward. So the era to the everybody must use it era, but we still have these questions of, does this software really help? And is it meeting this regulatory and billing requirements? So, here's what it may have looked like on the ground. Physicians start to spend longer times in front of a screen, because now, as opposed to locking in with your patient and figuring out what's going on, now you're just trying to figure out this system, and you're like trying to check every box that's needed, because I can't go on to the next part until I check all these boxes. So longer screen times, more required fields and check boxes to satisfy billing, like quality and compliance rules. Then you had all of this stuff from an insurance standpoint, from a compliance standpoint, that were built into these electronic health records. But when you looked at clinically, like, does this really impact this patient? Does it really impact what I'm doing? And a lot of times it didn't, but you had to do it for billing reasons or for quality issues and so forth. So there began to be less time, less eye contact with patients, less conversation and hands-on examination, because in a 30-minute visit, most of the time you were spending on your computer trying to click through everything that's needed to close the visit. So there was a feeling that the computer was taking over, and that the computer was more important than even the patient. Because when you think about it, to that physician, in order to be able to bill, in order to close out this visit, I have to satisfy all these electronic health record requirements. So there did seem to be this fight between what's required from the electronic health records versus your clinical obligation to listen to this person, to really put the patient first and figure out what's going on. In this Kevin Johnson 3-era story, it highlights that burnout in this period really surged. I mean, this was because the EHRs were mandated. It became, you could fight it, but you had to do it. It became a central part of a clinician's day. It became a central part of their whole cognitive process and natural workflow was not just seeing patients and figuring out what's going on. It's documenting all of this stuff. And so, doctors had to learn how to adapt. They had to learn how to evolve with these systems, but that came at a huge emotional cost and a physical cost as well, to physicians. You saw retirement in doctors who were in later stages in their career, and they said, rather than doing all this, rather than learn how to use these systems and so forth, I'll just retire. And historically, physicians would not retire until they were forced to or died. But because of that, younger physicians could learn from these more senior physicians. So you started to see more doctors retiring, not wanting to make this transition. Many clinicians report spending hours each evening doing notes, catching up on documentation at home. We call this pajama time. I know you've heard that several times if you listened to the show. So that extra time, a lot of times it was unpaid labor. It started to have just a more tremendous effect on doctors, leading to heavy burnout, chronic exhaustion, this reduced sense of accomplishment and just frustration with the system because you're spending more time. And we've done research on this that showed that you were spending more time just documenting than actually seeing patients and figuring out what's wrong, what you went to medical school for, your calling in life. So once we got to that era, it became more and more difficult for physicians, and there was higher burnout. There were some benefits, though. The benefits were that records were more legible. They were complete. You didn't have to worry about having to read someone's handwriting. They became accessible, so I can be over here, I can go to another hospital, and I can get that record through the computer without having to wait on a fax machine. E-prescribing, electronic prescribing, helped to reduce errors in prescriptions, like writing the wrong dosages and different things like that. Because when you had to prescribe a medication, like I said, there were so many checkboxes and alerts that you had to go through. So that did help to reduce some of these prescription errors that were happening because of paper prescription. And things like lab results, imaging can be tracked. I still remember the day where we had these huge, like these boxes on the wall, like boxes that would light up. So if you were a patient and you got MRI and I wanted to see MRI, you had to bring the MRI in and the films, and I had to put it up on this box and light it up. And then you had all these MRI records. We're like, well, what do we do with it now? So the good thing is that now with, we could track labs, we could track imaging, you could see it on a computer, and you didn't have to worry about these huge imaging slides and so forth that you needed. But on the cost side of it, there was this period where patients started to really feel that the doctor was paying more attention to the computer than they were to them. They would feel rushed. It was less personal because, again, this doctor's just looking, okay, I got this many number of patients I need to see today, but I know it's going to take me this much time to document everything. So these visits started to feel rushed, and there was a lot of miscommunication and so forth. So the second era had a lot of, it kind of shifted the emotional experience of practice. Healthcare felt less about the patient and more about just documentation. And that mismatch, it wasn't ideal for physicians. So you saw a lot of burnout, a lot of screen-centered work as well. So as we move into the third era, kind of where we are today and even moving forward in the future, there's still, from a clinician standpoint and a healthcare standpoint, there is still a high degree of optimism that electronic health records will continue to evolve and will hopefully get to the point where it makes physicians' lives better and become a powerful tool to improve care and control costs in healthcare. Unfortunately, right now, there are only 3 or 4 major vendors that are controlling this whole market of electronic health records. And to be honest with you, really one big vendor. Now, the benefit of that is that if you are on that system, then there is cross communication, meaning that there are records that can go back and forth. But on the flip side of this argument is that with consolidation with only 2 or 3 major EHR companies, there's less competition. There is a monopoly on the market. And so it's hard to really get change in this whole EHR system. So let's talk about for the patient, some practical ways, some practical takeaways that you can take away from this whole story of the EHR and its evolution and its impact on healthcare. So one thing is it's created a system where we have a portal now. The portals are a way that you as a patient can access your records, so you're not constantly having to call the doctor's office to get lab results, to get records. You can access your test results. You can look at visit summaries. You can look and change your medication list. So this helps you as a patient be able to spot errors and engage more with your healthcare provider. Couple of things to that, though. This is not a text message communication with your doctor. Sometimes the portal can be abused where, people just think it's like text messaging every day. This is how I feel today. That's not the purpose of the portal. So you have to be very careful with that. Is to review things and any type of meaningful communication with your doctor. We are looking at AI tools that help with things like AI tools that we've been using to help us respond to patient inquiries on the portal and that kind of thing. But the portal has represented a practical tool that patients tend to like. These new electronic health records have allowed you to prepare better for your visit. You can look at what's on there, clean up your chart better by responding through your portal, and really focus on the things that matter most. I would say that patients need to speak up about their visit and their experience. Pretty much everyone that leaves my office gets a survey. And in these surveys, what we want to know is, did you feel rushed? Did you feel that the doctor gave you adequate feedback? So this is your opportunity to advocate for yourself, to advocate for a better system, the things you like and even don't like when it comes to the use of electronic health records. There are a number of issues when it comes to privacy and data use. So we have to understand who protects these records, how do we house these records, because trust is central when it comes to electronic health records. As a patient, you don't want to divulge all this information if you don't know if it's going to get out there in public and everything else. So there's certainly regulatory things and HIPAA laws and different laws that we have in place to help to regulate that. And from a clinician standpoint, because I know several clinicians, listen to this show as well, doctors do, advocate for more human-centered design. We need to start speaking up about EHR at committees, optimization projects, any way that you can get involved. Now, I did mention earlier, there are not that many vendors when it comes to EHR, so it can seem like an uphill battle, but we have to start really talking about what's working and what's not so that we can change this system. There has to be a team-based documentation approach. Try to use nurses and MAs to document as much in the record as you can, and then you go in and just verify it. This can help reduce your amount of time that you actually have to spend inputting data. We have to start setting boundaries on this so-called pajama time. Protect personal time. Try to improve the system so you don't have to take this work home with you. And then we, as a house of medicine, as clinicians, you have to stay curious about new tools. And I think ambient documentation, AI decision support tools, all these things are going to come in and help and will integrate into our electronic health records and hopefully end up making life better. So I'm still optimistic that we're going to be able to improve electronic health records, especially with the use of AI, but control of the data is very important. So whether you are a patient, a clinician, a physician, or a leader in the healthcare system, it's important to understand the history of EHR and how it's really shaping our healthcare technology system today and how we can better use it to not put a strain on our system and put a strain on the human relationship, the patient-physician relationship, but how we can use it to enhance physician work through inefficiencies in different ways to make life better for physicians. So you've been listening to Your Health, Your Wealth. Thank you for tuning in. Today we explored the evolution of electronic health records, looking at 3 eras from early digitization to widespread adoption and regulation to our current age of optimization and AI, especially as how this is shaped through the eyes of physicians and physician burnout and even the patient experience. So I hope you found today's episode helpful in understanding more about this impactful thing that is happening in healthcare in the form of electronic health records, and how it has shaped everything from the flow of your doctor's visit to the impact on billing practices, and even the future of electronic health records and how we're going to move forward in this new era of AI. You enjoyed this episode, please share it with others and tune in for future episodes of Your Health, Your Wealth.